Good afternoon. I am from Department of Psychiatry, Assam Medical Center. And in this patient session for GBCC, I will be talking about better sleeping for breast cancer survivors. During diagnosis and treatment, insomnia occurs quite often. Let's say there is a symptom and you wait for the test results and you feel very anxious and depressed, and so you do not get a good quality sleep. After getting the results and after diagnosed, the insomnia comes back again. Before surgery, when you're hospitalized while waiting for your surgery, you are anxious, you cannot sleep very well. After the surgery, with tamoxifen and other anti-cancer drugs and radiation therapy, there could be burning symptoms during night, and sometimes you lie down during the day because you're tired, so you do not get a good sleep overnight. So let's talk about three major symptoms among cancer patients: depression, insomnia, and anxiety. 4 out of 10 have insomnia, 40%. So 40% of cancer patients suffer from insomnia. Insomnia is quite common. So with depression, insomnia, and anxiety, they are all because of the stress coming from the cancer treatment. So in relation with cancer, what kind of stress do we get? The disease itself and the cost of treatment and the lack of social support. There is a ward with 6 beds. For male warden, it's 12 people. There are always a caregiver. But for female patients, maximum 8 people are present. The caregiver are not present. So there are difference in gender depending on which type of cancer we're talking about. Of course, men need to go out and make money, so there are limitations there. But usually when father's ill, mother takes care of their spouse and they go home and take care of kids. But when mothers are ill, fathers are working. And there is an issue with marriage and kids. Some patients get diagnosed right before marriage and then or right after marriage. And for some patients, they have kids and they don't know what to do with their children. When you are diagnosed with cancer, this becomes a challenge to achieve personal goals. So there will be stress. It is inevitable. And how can we handle stress? To handle stress well, the probability must be higher. When we talk about the probability and predictability, let's say we are buying a house and we are sure that the housing price will go up. But on the other way, if it goes down, then you will never buy a house. But the thing is, we don't know whether it will become more expensive or less expensive. So how to deal with uncertainty? That it is important. Those who are strong, then they can handle stress very well. But they people with vulnerability in dealing with uncertainty, they're under bigger stress. So the improvement rate is 40%. That doesn't mean I'll be part of that 40%. You never know. So it's not certain. And probability is a way to deliver the possibility. So try to deal with uncertainty and be ready to embrace the concept that the future is not certain. Next is controllability. The situation of the treatment, the environment cannot be controlled. I have to do the scheduling, and I have to think about my child's schedule, and there are many factors that you cannot control. As long as you can control these factors, you will be under relatively less stress. Familiarity. before surgery, if there is a chance of a certain disease and a side effect, we need to get a consent form. And if it happens after the surgery, then it's a stressful situation. But the organs in our body, all of the organs are already inside my body, and you are familiar with these organs. So you have to remind that fact. The diagnosis and treatment procedure, please try to accept the situation and think of them as part of your life. Social support, I already talked about it. With a strong social support, you're under less stress. But if the social support is not provided, you'll be under bigger stress. And there are also personalities and other characteristic features. So these will lead to depression. Depression is about having interest in nothing. You feel depressed, you cry a lot, and you cannot concentrate. If the depression gets severe, insomnia is worsened. So it's important to deal with your depression. When you are dealing with your depression, of course, you take drugs and you get professional help. But one of the most important factor in dealing with depression is activity. When you are in a rehabilitation program, let's say you have a broken leg, you have to get to hospital for rehabilitation, and your leg hurts and you don't feel comfortable, and you might not be able to get the treatment. It's the same. To deal with depression, you have to move more. But with onset of depression, you think that I'll have to wait until my depression gets better so that I could be more active. But it's the other way around. You have to move first to reduce the symptoms of depression. And in depression treatment, there are a lot of help required. It's about support versus criticism. Support and criticism are commonly confused. To make sure that you want to get less stress, there should be the right timing for support and criticism. But when that does not happen at the right timing, it doesn't work. Let's say I am looking for a solution, but if you get is only support, that doesn't solve anything. When you need support, instead, when you get a criticism, you are stressed. So do you need support or do you need criticism? You have to pay more attention. Let's say our family member is ill. Do they need to be criticized or do they need to get support? You have to pay more attention and have more active communication. Providing comfort and providing solution, they are different. Men are focusing more on resolving problems, including myself. So that's what they do. However, relatively speaking, in case of women, they are more interested in providing comfort. So when they say, I have this problem, they just want to feel empathized. But a man would immediately think about how to solve the issue. So it becomes an obstacle, and sometimes you avoid communicating with your spouses. So when the comfort is required, please provide that first. Resolution comes next. And versus but. When we provide comfort, in most cases, you say something like you're doing well, but. So you say good things first, and then you connect the sentence with but. That means it's criticism. It's not providing comfort. Instead, you could say, I know you're having a lot of time, but you could do better. But usually people do not speak in that way. They start with good things followed by but. So instead of but, please use And is much better suitable word for providing comfort.
위로와 우울증 치료만으로 또 해결이 되는 경우도
So providing comfort and depression treatment can solve problems. Sometimes the insomnia persists. There are three different types. You cannot get to sleep, or you wake up frequently, or you get up early in the morning. One out of three will be insomnia. If these symptoms last, they will become chronic sleeping disorder. During breast cancer treatment, chemotherapy and radiotherapy will make you fatigue, so you lie down. After tamoxifen, there is a flushing at night and menopausal symptoms, and you get sweaty, and sometimes you cannot sleep. So it's mainly due to anxiety, concerns, and depression. Sometimes menopausal symptoms due to anti-hormone therapy and the fatigue after the anti-cancer treatment. You feel fatigue and you lie down most of the time and you cannot get to sleep. You have to have a good sleep, but you're not getting good sleep. So what do we do? The negative emotions start kicking in. You're worried and you are concerned, and then that will lead to negative behavior. I have to get a good sleep, so you go to bed early and you want to take a nap because you didn't get a good sleep last night, and then that will lead to negative thoughts. I'm not getting enough sleep. What do I do? So instead of moving around, you just stay still, and then it goes to negative emotions. So it's a vicious cycle of poor sleep. You have to get rid of your thoughts and you start moving your body. Let me get into more details.
잠을 반드시 잘 자야 된다.
Do we need a good sleep? Is it a absolute requirement? Of course, good sleep is good. Good sleep will always help. Then what about not getting good sleep?
시키는 여러 가지
There are factors aggravating the cancer condition. Sleeping is one of those factors, and sleeping is not all of them. So when you get poor sleep, the cancer gets worsened, but it's one of many reasons. It's not 100% dependent upon good sleep. So you start worrying, like, I'm not getting good sleep. So instead of doing that, if you do not get a good sleep tonight, you will get a better sleep tomorrow. So that is the starting point. You start taking sleeping pills, get more sleeping pills, or switch to different types, and then you become dependent on sleeping pills, and you feel more uncomfortable and anxious. So you go to hospitals and get a more sleeping treatment. In media, there is always people talking about good sleeping habits, but the contents of the good sleeping habit is not well communicated. I believe if we sleep 7 hours a day, for example, when you get up at at midnight, you become sleepy and you get up 7 in the morning the next day, 11 to 6, 10 to 3, and so on. So good sleeping habit is have a regular routine and having 7 hours of sleep and then 17 hours of activity. Let's say from midnight to 7 in the morning is the routine. The elderly goes to bed early and get up early, and they come to hospital and complain. But they don't say like that. They just say, I'm not getting enough sleep. So in this case, you go to bed early, so you got up early. So you got your 7 hours of sleep. That's it. If you want to get up late, then you go to bed late, and vice versa. And if you want to go to bed early and get up late, you cannot do that.
늦게 일어났으니까 늦게까지 잠이 안 오니까
So you get up late and you're not sleepy. So when you go to bed early, you can get to sleep. So in order to have a good routine, it's important to have regular pattern. You get up in the morning around same time every day, and then after 17 hours, when you become sleepy, then it's a good habit. So 17 hours of activity and 7 hours of sleeping is the best. To get a better sleep, you have to set the time to go to bed and time to get up. And don't lie down before the bedtime, and you just sit. And then when you are not sleepy, try not to check the watch, and try not too much to get to sleep, and relaxing exercise might help. I lie down during the day because I didn't get enough sleep last night. When you're lying down during the daytime, that means you're sleeping. People misunderstand that I just lie down. I wasn't sleeping, so I didn't get sleep during the daytime. We have bread and other snacks before meal. You lose appetite. So it's the same thing. When you lie down during the day, that means you are sleeping during the day. And it's to make up the loss of the sleeping last night. But I mean, if you skip your dinner, do you have double of the lunch today? Not really. If you have double of the lunch, then you won't be able to have dinner. I mean, you slept during the day. That means you slept early. So the start of a day is when you get up. So you start your day in the morning. So you get up in the morning and you move around 17 hours, and then you sleep for 7 hours. So when you sleep during the day, that means the start of your day is in the evening. The start of the day is in the morning. So get up in the morning, move around 17 hours. When you didn't get enough sleep last night, that's it. So it's always after you get up in the morning. So every day it's a fresh new start. You lie down because you are not sleepy. So if you don't feel sleepy, just sit. And when you go to bed early, you're not really sleepy. People tend to go to bed early and try to sleep at 9 or at 7. That means 10 hours prior to your getting up time. So when you go to bed early, you don't feel sleepy. If you go to bed late, then you would feel more sleepy. Taking sleeping pills and you go to bed and you are not sleepy. It's all about timing of the sleeping pill. 7 hours before your get up time. So when you get up at 6, you take sleeping pill at 11. Get up at 7, you take your pill at midnight. If you want to take your pill at 9, you have to get up at 4. It's actually waking up from your bed, getting up from your bed and start moving around. So try not to lie down during the daytime. Move around your body and then go to bed at the right timing and get up in the morning early and have a lot of physical activities. This will help with your depression. When you do not get a lot of sleep and when you feel depressed, be active during the daytime. Go outside and take in a lot of sunlight. And diaphragm in inspiration. So you inhale slowly with your nose and exhale through your mouth for 5 seconds. Inhale 5 seconds, exhale, and you repeat this cycle. Then your muscles will be relaxed and your your anxiety will go away. When you're not sleepy, you start thinking about many things about treatment and other concerns with your family and etc. Instead, try not to do that by having diaphragm in inspiration and expiration. So don't be obsessed with the thought of getting asleep. So please make use of the diaphragm in inspiration and in inspiration and expiration. So far, I talked about how to get a good sleep and how to manage your stress. Thank you for your interest.